We'll go ahead and turn it over to Amy to do the roll call.
Yeah, we'll do the roll call, and I invite the chair to remotely take over her role. Unless we lose your input, then I'll,
There it goes.
you're coming in and out.
Okay, Dr. Jones,
Here.
David Thies,
Here,
Kathy Emanuel, Dr. Peterson,
Here.
Dr. Goodling,
Here.
Dr. Sander,
here,
Dr. Reichstack, Dr. Sharma, and Beth Benich, they're not.
Not a doctor, but you.
Thank you, Amy. Thank you, everyone, for your attendance at the meeting this evening. Our next agenda item is to approve the minutes, to approve the agenda of today's meeting. So I will entertain a motion to approve our agenda.
So moved?
second,
Moved and seconded. Any discussion? Hearing none. All those in favor?
aye.
Thank you. Anyone opposed? And of course, I'm remote, so I will need to abstain for these votes. The next item on our agenda is approval of the minutes from August 19th. I would entertain a motion to approve the minutes.
So moved?
Second,
So moved by Bethany and seconded. Any discussion, changes, corrections to the minutes? Hearing none. All those in favor?
aye.
Anyone opposed? And we have one abstention. I would invite public participation on agenda items. I do not see anyone present from the public. I don't think there's anyone hiding behind anybody back there. Mandy? Mandy, Whitney, anybody? Okay. So we will move on. Correspondence and communications, that's usually Julie. There is an important item on the agenda. She might have mentioned to some of you at the board meeting this evening, talking about those that are unhoused and how that will be handled or managed moving forward. And so she wanted to be there to provide public comment on that issue. So she apologized.
You're coming in and out.
Yeah, it keeps kind of knocking me out there.
She's what, silent?
Can you hear us,
Can
Krista?
you hear us?
Yeah, I can hear you guys fine. You couldn't hear me? I was coming in and out.
You're coming in and out.
It just kind of blinked. Oh, there it goes again.
It's not you, I think it's the
Yeah,
system.
it's
She's
the
not heard.
Yeah, just
cable
keep talking.
is not-
Okay.
Just keep talking. We're good.
Well, to attend tonight's meeting because she is at the county board meeting. There is an item on the agenda talking about those that are unhoused in the community. And she wanted to speak to that item. So that's why she's not able to attend this evening, and she apologizes. Moving on, our next item is other business, which is a discussion of the County Board of Health budget. As you remember from our August meeting, we had some questions in regards to our percentage of where we were at on the fund balance. We had, as a committee, determined that we would like to keep the fund balance at 30 to 35%. Particularly in our discussion in August, there were concerns about the lack of federal funding for public health initiatives, or should we encounter any concerns, whether that be an outbreak of something, whether that be foodborne illness or an outbreak of a particular disease. This is where we would need to have resources to address that. And it's unlikely that there will be additional federal funding that would become available, similar to what we experienced with COVID-19. So we had, you had asked me to invite Travis to this meeting to speak about that. And Travis is also joining us remotely because he is ill this evening. So we really appreciate that he's here to answer or address any questions you might have. I asked him just to begin with comments about where we are currently on the fund balance. So I'll turn that over to Travis.
Hi, everyone. Sorry I couldn't be there in person. As Krista mentioned, me, my wife, and 2-year-old kid are really sick right now, and I did not want to pass that around. So I'm remote in. I've got a very quick, just kind of introduction and I'll say presentation, but it's not really a presentation, and it kind of explains where the Board of Health is with the fund balance. And then I'll open it up to questions. One thing I will say, since I don't really have access to the accounting system or my files and my office right now, if there are specific questions, like to the exact dollar amount, we might have to do that online. Mandy and Julie have my contact information, so I'm available anytime anybody needs to get a hold of me or has questions. I see Beth over there anyway, and she has to deal with me a lot at the county anyway, so it's easy to get a hold of me. So for those of you who don't know me, my name's Travis Woodcock. I'm not going to turn the camera on because I look horrible, being I've been sick for a couple days, but many of you might know me. I'm the finance director at Champaign County. About a decade ago, I worked with Julie and Mandy at CUPHD. I was the accountant at CUPHD for about 5 or 6 years. After that, I moved to the city of Champaign and worked there as the financial analyst. And then about 2 years ago, I moved to the county. You guys are probably pretty familiar with Tammy Ogden. When she moved to RPC, I was hired at the county. The jobs don't exactly mirror to what it was, but it's very close. So you can kind of consider me the new Tammy, in essence. Mandy and I had been talking, and she had mentioned that the Board of Health had some questions about fund balances. So I'm just going to give a really quick, high-level summary of the fund balance for Board of Health, and then turn it over for questions. Since about 2018, the Board of Health has had an unrestricted fund balance hovering just over $500,000. In the past couple of years, though, the overall fund balance has grown to over $600,000, but part of that is restricted due to a SEPA grant. I don't have the exact dollar amount. Mandy gave it to me, but it's on my desk at the office. It's a bit over $100,000 that the Board of Health cannot spend because it is owed for a SEPA grant. So any calculations that we run for the Board of Health, we should use unrestricted fund balance and not include that in the numbers. So when you subtract that out, even this year, the Board of Health is projected to be about just over 500,000, maybe 520,000, right around there. It's estimates because one, the county, which the Board of Health's fund is audited under, the audit for 24 is not done, and we're still currently in 25. So these numbers are estimates. They shouldn't change drastically, but they're not finalized either. So knowing the overall unrestricted fund balance dollar amount is useful, but it's more important to compare it to the expenditures that the fund has. So you do a ratio. Basically, it's the fund balance divided by the unrestricted fund balance, the unrestricted fund balance. Let me start. The unrestricted fund balance and the expenditures for the year, and you come up with a ratio to see basically how long you can last if no money comes in, how long you can survive on fund balance. When I started at the county, I tried to see if I could find an official policy with the Board of Health, and I never found anything in the bylaws, but as Krista mentioned, the Board of Health had some emails, and the discussions had always been about 25 to 35%, somewhere in that range. And having a range is a good idea instead of just a certain percentage. Based on current projections right now, at the end of 2025, the Board of Health's fund balance percentage will be about 26%. So definitely in the goal range of 25 to 35%. That can fluctuate depending upon the CFA restricted amount, how the fund balance actually finalizes once 25 is done, fiscal year 25 is done, but it should be right around 26%. There are also, and I'm not going to get too deep into the weeds, this is something that we could discuss in the future. There are other ways well, not necessarily other ways, but items that you can add or remove to make this calculation. This calculation is the way that it's always been calculated before my time, so I kept with that same exact calculation. But since the Board of Health does have some pass-through money that goes straight to CU-PhD, it could be possible to change that calculation to not weigh that pass-through as much in the calculation, because it's not it goes straight to CU-PhD, so just pass-throughs are a little different. But we can talk about that later if we needed to. As Krista mentioned to me, I was going to suggest not spending down a ton of your fund balance right now with the federal government the way it is right now. But you guys have already, it looks like, talked about that and agree with me on that situation. I don't think it would hurt to have an official fund balance policy sometime. That's nothing that is urgent. I'm actually trying to work on updating the county's fund balance policy throughout the next year or so as well. It's not a bad idea to have that officially in policy, but that's up to you guys. As long as you have a stated goal and you stick to it, it just helps with future board members if you have it in policy.
Travis, while you're on that point, we passed that as a matter of one of our meetings, so it is in the documentation of the meeting minutes. However, I get what you're saying. Are you suggesting that we have a bylaws change and just have something added to our bylaws in regards to that?
I don't know. I mean, as long as someone has record of it somewhere, like I know of it now, Mandy knows of it, but you guys all know of it. But in 5-10 years, who knows who will still be around? So I don't necessarily. That's up to you if you know bylaws or anything like that. But I would just kind of make sure that it's easily available for future people. That's all that I think. That's the important part. Because like I said, when I started at the county, I was trying to find it, and Mandy actually sent me the minutes that you're referring to. So I have those. She has them, but like I said, in the future, both of us might not be here. So that's basically all I wanted to discuss. Is right now you're in your goal. You're just above 25% as a projection. It could fluctuate a little bit, but probably not too far. And again, I would, like Krista said, I would not spend down under 25% too far with the way the federal government is. In the future, if things get back to a little bit normal, I guess, that's a discussion you guys could have later. But for now, I think keeping it above 25% is a good idea.
Thank you.
Are there any questions?
Yes, Travis, John Peterson. This probably came up because we had been discussing over the last two board meetings just exactly what our budget amount is, and the budget that we're passing is not 2.2 million, which was listed in the explanatory sheet, but is actually more like 1.2, and that markedly increases what we think we need to use as a carryover. We were told that your office, we were told that your office was having some difficulty disaggregating the property tax pass-through to CUPHD from county residents. And that is what made it difficult to come up with a budget number that was in fact realistic to what we are passing every year. Do you have any thoughts on that?
Yes, so you are correct, and that's when I was mentioning the calculation, that's the portion that I was talking about that we could change in the future. You're right, it's about $1.2 million for Board of Health and about 900 some thousand dollars for pass-through. If I might be off a little bit there, but that's pretty close. Historically, the county has always kept that in one fund. It's one large fund. So the calculation has been based on the expenditures in the entire fund. Going forward, we could break it out. The issue is trying to find the historic separation of them. And you are correct. If you break that amount out and don't include that $900,000 pass-through, and just use the $1.2 million, assuming that all that fund balance is full Board of Health, the percentage would be closer to, I don't know, 40%. However, without going through historical data, some of that fund balance is probably part of the pass-through fund balance as well. So it wouldn't probably be that full 40%, but you are correct. It would be much higher than the 25% that's always been historically calculated. So my suggestion is, if that is something that you guys would like to break out, I don't think it's possible to do for this budget year, but we could work together. I could work with you guys. We would have to do some historical kind of digging through. I would have to work with Mandy and stuff to see how that fund balance would break out all the way back to however far back we go. And then we could start calculating it differently if we have that separation, and your fund balance percentage would be higher. However, your overall expenditures would be lower, so it would fluctuate a little bit more. So if that was the case, you guys might want to update your goals as well if that happened, just because there's a lot easier fluctuation when you're basing the expenditures on a lower amount, if that makes sense. But I do agree with you that trying to find that breakout, historical breakout that's never been done before at the county would be beneficial. And even if you did a calculation on both numbers and had kind of a goal for both, like the overall number be over 25% and the other number be another range, I think that would be a very good idea.
Do I understand, Travis, correctly, this is David Thies, that part of the fund balance that you indicated was around $500,000 if you eliminate the grant money or the restricted money, part of that fund balance is allocated to the pass-through, I guess that's the CUPD part?
So that's the thing, I don't know. It could be because it's all wrapped in one fund. It might not be. I mean, if it is, it's probably a very small amount, probably just due to rounding and things like that. But I don't know. There would not be a significant number in that. But like I said, it would probably be more tied to things like the property tax, the dollar amount that comes in at the end of the year doesn't always match exactly what is levied or estimated at. So it would probably be whatever that difference is, if there is any.
Thanks.
I have to, Peterson again, I have to admit to some ignorance. which is always difficult for me to do.
We'll be the judge.
On this restricted fund that you talked about, because I don't think it was highlighted during our budget discussions, but I could have missed it. The money that I thought we were kind of holding back on was that tax settlement issue.
So there is a SEPA grant portion, and Mandy would probably be better to answer exactly what that's for on that. I don't know if she's back there now or wants to do that at a separate time through email or whatnot, but I did get that restricted dollar amount number from Mandy for the SEPA grant specifically.
So it's about 131,000, I believe. The SIPC grant paid at the money up front. So until we actually spend it all, we have to hold that money back and not spend it on anything else. That's why it's restricted.
What does that, what are those deliverables for that grant?
Bob was probably talk about that.
So it's the Strengthening Illinois Public Administration grants. We have funds dedicated towards trainings. We also have retention bonuses for staff. It is a multi-year grant that I believe ends, I think it's November 27.
We have discussed that grant, yeah. I just didn't see where it showed up in our budget breakdown. Yeah, that's your staff retention grant, right? Okay. It would be good to, when we get all this underway, that sort of be highlighted so we can, you know, in the breakdown so that we can take a look at it.
Krista, am I also correct that we have not made a decision on the dental recruitment portion of the budget? It's not in the amount that we were talking about?
That is correct. So based on our vote on the budget in August, we determined not to fund that particular portion for them, and they've been notified of that. We are still continuing our commitment to fund at $50,000 childhood dental health care in the community. And we're also funding at $30,000 the teen pregnancy prevention grant, which I know that's not the exact title, Whitney. I'm so sorry. Can you tell me the exact title?
Champaign County Health Education.
Thank you. So we did continue to fund both of those projects. We didn't continue to fund that recruitment because there was some concern over how the money had been spent. I provided that 5-year review of that funding, and they were invited 2 times to come to meetings to answer questions from this group and did not attend. But I also want to mention that they are going through some staffing changes, so that may account for that. But we did reach out to them to invite them.
From the minutes, it looked like it was still an open issue.
No, it isn't
But
open.
we closed it. I remember the vote, but
Yeah.
the minutes
Yeah.
indicated we were waiting for them to give us more information.
And I think, you know, if they come back with a different proposal next year, or if anyone, for that matter, comes back to us for a proposal that they would, you know, something that needs fund in the community, I think we can revisit where we're at in the fund balance. I can certainly work on the bylaws change to incorporate for our next meeting to put forth to the board about making a change to state specifically in there where we want the fund balance to be. And that would be part of the discussion after Travis leaves the meeting and we answer all of the, or you ask all the questions that you have, is determining, do we want it to be a specific number? Right now we have a range of 25 to 35. Do we want to say it needs to be 30? Do we want to say it needs to be 35, 25? Whatever it might be, I think that's something we can entertain as a discussion afterwards.
I also think the decision is open as to whether it should be part of the bylaws. There may be other ways to make sure we remember it in
Oh,
the
sure.
budget process, but whether it should be in the bylaws, that's something we should think about.
Yeah, I mean, if we had an operations manual, I would say put it in there as part of policy, but we don't have something to that nature.
Well, and is there, Travis, is there any indication from your discussions with other county departments as to whether there might be a county-wide target?
So for the county, we have a specific fund balance policy. I have been working with our finance committee to potentially update it. However, the financials at the county are a little unstable right now, like with everywhere. So I don't know how quickly that will pass, but or that we would do that. But the official policy for the county is 16.7% for the general fund, but our internal goal is 25%. And that internal goal is kind of based on our financial advisors for when we go out for like bonds and stuff, because our bond rating is tied pretty hard to that. So, however, that does lead me into another thing that I wanted to bring up. GFOA, Government Finance Officers Association, they have a really nice work paper for governments, and I will forward the link to Mandy and Julie and Krista. I think I have your email as well. I can forward it to you as well. Because every government is kind of different on what their goal should be based on a lot of different factors. So this work paper that they have, kind of, you go through it as for your specific government agency. It talks about strengths, weaknesses, future plans, capital, those kind of things. And then it kind of gives you a range goal that they suggest for it. So if the overall county does it and Board of Health does it, it might be two widely different ranges that they suggest, especially due to the County Board of Health being much smaller than the full county. But I think that is a helpful thing, and that's something that I'm working through on the county as I'm working towards potential changes to policy. So.
Thank you, Travis. Are there any additional questions for Travis?
Look forward to working over the next year.
I'm sorry, David.
I just said look forward to working over the next year to put some of this
Yes,
down.
absolutely.
Dave hasn't been working much at all the last couple of years.
Well, thank you so much, Travis. I hope you get to feeling better. Thank you for attending tonight. I know it was a lot to do that, so thank you. We really appreciate it.
Yeah, thank you all. And if anyone has any other questions, contact Mandy. She has my contact information, and feel free to reach out anytime.
Thank you.
Travis. Feel better.
Okay, bye.
So in follow-up, I just wanted to kind of open it up. This might be something, I'll follow up with Julie. And Mamadou, are you still there?
Yes, I'm here.
Do you have any additional suggestions beyond a bylaws change for policy regarding the fund balance? Or ways we should go about that?
At this time, no, but I'll take a look and potentially get back to you guys.
Okay, thank you. So may I follow up with Julie and Mamadou then about putting that together and finding the best way before the next meeting and put something together for all of you. Going forward, what would you like to see the fund balance be? I mean, right now we have it as a range. Do you want to see a specific, as Travis said, the county's goal is 25%. We're in a range area. Do we want to be more specific with that as we're working on this policy?
It doesn't matter too much. If we have a specific number, it still is going to be a range, because we're not going to hit the specific number. So a range,
Right, but
range
a
makes some
target,
sense.
I guess.
It may be 10% is too much, but either way, you could have a specific number that's a goal.
Or like a minimum threshold of like,
Okay.
you want 20%, this is a minimum, but then more than that would be ideal.
Something. I guess the point is a little bit of flexibility.
Yeah, I agree.
I would set a minimum and then
Yeah.
that's
I think that'd be
reasonable
fine.
and won't give the county.
A minimum with a range. Like that,
At least as much.
that's kind of essentially what we have. Yeah.
Yeah, I don't think we're talking about changing a whole lot. It's more a
Yeah.
question of how do we memorialize it and put it somewhere where we'll remember it.
Thank you. We can work on that and then get back to you on that particular issue. Any other questions or comments about that?
But I think if we break apart the pass-through piece too, I think that's gonna really determine a lot what the percentage, if we're going by percentages too, right? It's gonna have a
Right.
huge influence. We're at 26% now to 40-something% if we get rid of the pass-through. So if Travis and others, if all of us can break that apart more and have more delineation there, we could have a little more clarity, which would be helpful.
And you also want to have a discussion as to the percentage, fine, but I mean, how much money do you think you're really going to need if something big happens? And so, 25% of the actual budget, 1.2 million may be too small if something big hits.
Yeah, I mean, in COVID, we went through, Mamadou, the first was the $1.2 million grant, and then Mandy, the second was the $2 million, like 2.2, is that correct?
I'm thinking like 2.8, but I'm not positive.
2.8, okay, my apologies. So I know we went through the 1.2 quickly, and then we moved into the 2.8, which, we didn't expend as much because we had to set so many things into motion with the vaccinations and all of that early in the beginning.
That question is
So-
really where the discussion should start, is the
Yeah.
gross dollar amount you might need.
Yeah.
Then you can
Right.
back into the rest of it.
All right, let me follow back up with Julie on some of that then, and I'll come back to the next meeting.
But that is.
Thank you all for that discussion.
Yeah, that's a.
Yes, Lyndon, I'm sorry.
Yeah, that's really complicated to say how much you're gonna need. There's so many factors, right? So, well, you'll need a hell of a lot if you've got administration that won't give you money to help you with public health. You won't need as much if you got, you're actually working in concert with state, federal authorities to meet whatever your goal is. So, I don't, I think having a range within the budget, I mean, if it's so bad that no amount of money is gonna solve it, well then.
Yeah, the
we'll
whole
try.
1.2 million wouldn't have covered.
Right.
Well, but
Just won't
that's a judgment, I mean, that's why they pay us the big bucks. That's the judgment call we have to make.
Yeah.
You can't just say, well, let's get 20% of whatever. You gotta start somewhere.
Right.
And it's like, assume the worst. Well, we can't do the worst, but
Do
somewhere
something
there's a
underneath
number.
that.
I just feel like at least in my mind, I'm thinking, at least we have a starting point in terms of, as an example for COVID, right? Like we know that there is a data point there that we can base our plan on that, and that can be an argument for the board to consider and say that we want.
That should be our baseline.
Yeah, like a baseline. That's what I'm thinking. And based on that, because right now, there is a lot of other things that we can think of in terms of infectious disease threat, but
Well, everybody's looking at bird flu.
yeah.
Great.
Thank you, everyone. The next item on our agenda is approval of the 2026 County Board of Health meeting schedule. That was included in your digital packets that were sent to you. So the meetings that we have scheduled for 2026 occur on March 17th. These are all Tuesdays, June 16th, August 18th, and November 17th, and all to be held at 5 o'clock. Are there any concerns with any of those dates?
March 17th, spring break.
Oh, yeah.
So I know I would be
that
out
is
of town with my kids at that point, so,
We ran into that problem with county board meetings.
you know.
That is true. Let's take a look at March
Before or week
17th.
after.
I think we have never held to the schedule that we have passed at this point.
Because
We are flexible.
I don't know where I'm gonna be on, that's right. I'd say.
We are very flexible. Do we want to look at the 24th then, everyone of March?
Okay.
You tell me what's better.
Well, the spring break comment is
Yes,
legit.
that's a major, yeah.
So
Yeah, so we can move March 17th.
Yeah, 24 sounds good.
Yeah, change it to the 24th, change it to the 24th.
Sounds good to
Yeah,
me.
Is the 24th good for everyone if we change it to the 24th?
Put it in the calendar.
Caroline.
All right, so let's say March 24th, June 16th, August 18th, and November 17th.
I move approval.
Thank you. Do I have a second?
Second.
Okay, moved and seconded. Any further discussion? Hearing none, all those in favor?
Aye.
Anyone opposed? And one abstention. Thank you.
And the 5 PM is good.
Our next item are the Smile Healthy reports. We have reports in your packets for items for July, August, September, and October. I would entertain a motion to approve and place those on file.
As an omnibus?
I'm sorry?
As an omnibus?
All of
Yes,
them, all of
thank
them,
you.
Yeah.
Yeah.
I will move that. Or second that. if you're ready.
Second.
Moved and seconded. Any further discussion? Hearing none, all those in favor?
Aye.
Anyone opposed? And then one abstention. Item 5 under H is approval of the invoices for payable to the Champaign County Administrative Services for the Child Dental Access Program in July in the amount of $6,249.99. And then we have a same equitable amount in line item 6 for approval of those invoices for August of 2025.
And
And then-
7 and 8, yeah.
7 and 8.
and
Yeah, then we
seven.
also have, go ahead, Dr. Peterson, I'm
Turn the
sorry.
page.
We're
Yep.
moving the meeting along.
Yeah, on 7 and 8, we have the months of September and October for the same amounts.
I'll move all four.
Second.
Thank you, an ominous motion, moving all four. Do I have a second?
Second.
Thank you, seconded by David. Any further discussion? Hearing none, all those in favor?
Aye.
Anyone opposed? And one abstention. Underneath I, CUPHD, we have approval of the CUPHD invoices for July and August in items 1 and 2. I would also entertain a similar motion to pass those.
So move.
Moved by Beth, do I have a second?
Second.
Moved and seconded. Any discussion of the CUPHD invoices? Hearing none, all those in favor?
Aye.
Aye.
Aye. Anyone opposed? And an abstention. Thank you. The next is approval of the Champaign County contract. As you recall, we have had new change in statute, so we will have to approve these contract expenditures from time to time. So this is the IDPH Public Health Preparedness Grant for FY26 in the amount of $62,726 for the time period of July 1st to June 30th, July 1st, 2025 to June 30th, 2026. I would entertain a motion to approve this contractual arrangement.
So move.
Second.
Moved by Beth and then seconded.
Yes.
Any discussion?
So
Hearing
this is
none.
only,
Oh, go ahead, Dr. Peterson.
excuse me 1 second. Yeah, this
Yeah.
is only for, even though the contract is for 5 years, the approval is only for 1.
That is correct. We have to do them in parcels. And Travis, I know is gone, but that was what was recommended to us. Every time an expenditure is made, we must approve it.
Okay. Well,
Any other questions?
Yeah, I'll state that, of course, I do actually look at these, and this had a large number of deliverables on it. I mean, this was more than half the contract was the deliverables, which is, it wasn't one of these small things.
Right.
A lot of paperwork on your department over there.
They're working very hard and we appreciate each and everything that they do.
Yes.
Any further questions? Hearing none, all those in favor?
Aye.
Anyone opposed? And 1 abstention. Thank you so much, Amy, for recording all of these. You do an absolutely brilliant job, and we're very appreciative.
Thank you.
Next, Whitney, update on the Champaign County Education Program.
Yay! So to date, these are unofficial numbers for the calendar year, because we're finishing up some schools in December. So we've had 132 students, 10 different cohorts or groups of students, with 6 different partners in the county. So Fisher High School, Fisher Junior High School, Ready, Rise Academy in Rantoul, Juvenile Detention Center, and Thomas Borough Grade School is where we've been. And then we have some staff feedback I wanted to share that I thought was festive. This is from Natanya Wells, who is one of the social workers at Rise Academy over in Rantoul. And she said, health education lessons provided to Rise students offered a safe space for students to learn about important topics related to puberty and sexual health. Some common misconceptions were addressed, and students learned about resources available to them in their community. The presentations were age appropriate and foster ongoing conversations even after they ended. That's my update.
That's fantastic.
Yeah.
Congratulations, that's great to hear. Any questions for Whitney? Thank you all so much. Our next items are updates on the reportable disease report. I know there were some questions from the last meeting on these reports as well as the performance management. I open it up for either of those for discussion, and then would entertain a motion to place those on file.
I'll move to place both of them on file.
Second.
Thank you. And moved and seconded. Thank you.
Now,
Discussion.
Of course, I did look into them in preparation for the meeting tonight. And I do see that you've got the statement in there now about the lack of reporting until the end of the year and a reason for that. Now, on performance management, which frankly, I'm not going to put it down as the most important report I've read. This time, when I went into it, I got a notice of page not found. But immediately, a solitaire game for tic-tac-toe came up. And so, what that suggests to me is that what's really going on in this building is a lot of video games.
You already switched on the link.
Investigator
So
Peter
it says pre-performance instead of performance on the link URL. So I just realized that myself. And it's the website. So should be cuphd.org/PERFORMANS. So
Oh, is that the?
yeah, so then if
that's
you do
the
that, you don't,
Okay.
I didn't get the solitaire, I did get the page not found initially. I never saw solitaire.
Yeah, I was very concerned. I was very concerned. So that's the typo, so.
The site's active and you can
Yes.
see where they're at for current progress. on the
Okay,
programs.
thank you.
Yeah.
Thank you so much. It's like solitary.
How is the tracking system being utilized? Like, has it been for school, for each of the program areas and stuff too, or like how has that been?
Yeah,
utilized?
so I think it has been very beneficial in terms of not only programs but also for FAB accreditation. So I think one of the requirements for FAB accreditation, which all local health departments are required to submit their performance review, is that it allows us to track over time and also, compare, year to year how much impact we're making in the community. I think that's very useful in that sense. And also in terms of infectious disease, like I think that the example that I gave last time for TB, we can also track like the number of TB that we are having in our community year to year, and that also really helps in terms of planning for future disease investigators, hiring for future disease investigator, and to better prepare them for those type of jobs. So overall, really, I think each division have at least 2 tracker for their specific program if you look at it. And I think that at least in the standpoint of administration, I think that's very beneficial.
I think the transparency too holds people accountable. So lets them know that, it's not just people in your program that are looking at these, it's the board and the public and our colleagues.
And since this is the first year that you have had this platform in place, is that right? Or is it-
No, we've actually had a performance management system now for a while, I think since 2014. We just revamped it within the last couple of years. And we do have at least one measure in there for every program here at CPG.
Are there any other questions?
What the heck happened with rabies?
Yes, if you look at it, that's one of the that's one of the highlights. If you look at the data.
21
this year.
cases of rabies at the university? Like, what the heck? Did the dog come into the vet med and everybody got exposed?
Oh no, you want to speak to that?
Yeah, so it's rabies post-exposure prophylaxis. So if a person was exposed to, say, let's say a bat, and they seek care, then they would administer rabies post-exposure prophylaxis to prevent a rabies infection.
Okay.
And it just, we've seen an uptick in rabies post-exposure prophylaxis since the pandemic, and really don't know why that is. I think there's just in general more awareness now about that, is my guess. But yeah, I really don't have a good answer as to why we're seeing that uptick.
But in my view, I think it's also a good thing that people, when
Yeah.
exposed to rabies, seek a healthcare provider and get vaccinations. So,
Yeah, no, absolutely. Is there something we should know?
I want to really commend all of the staff for all of the hard work in putting this together. Just coming from the APHA conference and speaking to many other health department directors and leaders, we really are far advanced in this community for the kind of data that we track, and then making that data easily accessible to other individuals through the dissemination that you have. So I really want to commend all of you for that. It's really ironic how much we do capture here, and I know that takes a lot of hard work, so thank you.
Thank you.
Any other questions for the staff? Okay. We do not have a report on old business under J because Kathy is not here, and from my last communication with her, not much has changed since the grant was announced, not been received yet, but I know they're still doing a lot of preliminary work around that. So hopefully at the next meeting she'll have a report for us. Our next item is public participation on our non-agenda items. I have not seen anyone else come through the door. Hopefully I didn't miss anyone.
They can't get through the door.
Oh, that's right, it's locked. I forgot. That's a good point, Dr. Peterson. Okay, our next meeting is, instead of March 17th, it is now March 24th. So our next meeting is March 24th at 5 p.m. If there's no other business, I guess, Mama, I just want to give you the opportunity. Do you have anything you wanted to share with anyone?
Just potentially, just to share something to the board, to keep that in their mind, that we are really working really hard to review the fees for inspections, for restaurant inspections. So we look at, we did a lot of studies and look at other counties. So we are far behind many counties in terms of fees. So we are reviewing that, and the plan is to come up with that increase with all the study that we have done, so that give you guys options to vote on what we should do to move forward with that. But the plan is to increase fees at some point in the next coming, Board of Health meetings.
Will that be common with the district too?
Yes.
Are we behind the district, or are we at par with the district, or are we behind the city district?
So can you clarify that?
We're county, what's the city charge?
Yeah. So the plan is first to submit it to the district Board of Health, and then once they move forward, so we'll come up, we will share with you guys and see what you guys want to.
I just wondered if we were behind them already or.
No,
Okay.
yeah, we haven't shared with them yet.
Okay.
Right now, we're just doing a background information studies. We did a lot of, we compare a lot of our fees with a lot of county and noticed that we are way behind.
Right.
So, in terms of the inspection fee and inspection fees and also cottage food inspections, a lot of, yeah. So we just plan to come up with that at some point and share that with you guys.
Do you have
Thank you for sharing that.
do you have a rough idea at all, like how much lower we are? Like, are we gonna be doubling the fees, or like, do you have a sense at all at this point?
Yeah, I look at the data. I just don't want to speak, arbitrarily without showing you guys the data. But for what I've seen, we are not doubling it. But what we did in terms of the study, we compared 5 more county, and then add those numbers. For example, for level 1 inspections, we add all of their fees and divided by 5. And the average, we took that and then see that with the average, we're still below. So we just want to make sure that you guys see that we are a bigger county, and some of those are really small county, but their fees are increased. With inflation and all of that, and also our staff, the time that they spend doing an inspection, we feel like we need to increase that.
Have you thought about building in a yearly increase just to keep up with inflation?
Really, all of that are part of the study for you guys to decide, but at this point, I just want to make sure that you have that in your radar that we are coming up with that. But one takeaway is that we are behind Woodruff County in terms of the fees that we charge people for inspections.
Thank you very much for sharing that. We'll look forward to updates in the next meeting or two.
Thank you.
Any other items? Questions, concerns? Hearing none, I will entertain a motion to adjourn.
So moved.
Second.
A motion, do I have a second?
Peterson, second.
Okay, thank you, I couldn't hear.
Anybody gonna
So
object
moved
to
and
that?
seconded. All those in favor? Anyone opposed? And then again, the one abstention. Thank you, everyone. I hope you have an absolutely wonderful holiday.
I want to declare the meeting
Take care.
finished since I started.
Thank you.
Thank you so much. Take care, everyone.
You like to
Motion.
start?
Good, how you doing? To reference.
Yeah.
Where are they? DDA.
Do you need the email?
Take the grandkids sledding.
Oh, yes.
We're very efficient. We're very efficient.
Yes, I appreciate it.
Now,
I was just looking at my turn is in June.
I'm sure they'll always take you on for another one. That interferes too much with your golf game, though.
Well, now that we are trying to get as much as we can